I want to do a little demonstration for you. We had some connectivity issues earlier, so let's just see if we can talk to my friend. Hey, Suzie.
Hello, how can I help you today?
I'm here talking to my friends at CalCIP. Would you mind saying hello?
It's an honor to be at the CalCIP 2025 annual meeting. It seems like Vanilla Singh has done a wonderful job this year.
She certainly has. Do you remember my name?
Of course, Dr. Sexy Pants. How can I assist you and your friends today?
So, can you tell them what my job is? What's my job?
Your job focuses on saving 1 million lives.
Can you tell them how I want to do that?
You're working to transform the U.S. healthcare system by improving chronic pain care, mental health treatment, and substance abuse disorder care, especially for opioid use disorders.
Do you think it's really possible to save 1 million lives over 25 years?
Absolutely. With dedication and the right strategies, you can make a significant impact over time.
What would you do specifically in those categories? Which one do you think will move the needle the most?
Focusing on opioid use disorder care, especially by starting Suboxone microinductions immediately, could have the biggest impact. Treat them when you meet them.
Say that again. What do you mean by that?
It means starting Suboxone microinductions right away when you meet patients, ensuring they get immediate care for opioid use disorder.
Okay, we're going pretty far here. A lot of people in this room have probably never written Suboxone, and I don't want to waste too much time on this, but are you saying that we can do a small dose of Suboxone the moment we meet them?
Exactly. Starting with a small dose right away can help patients quickly and make the treatment process smoother. It's a proactive approach.
Tell me what buprenorphine is.
Buprenorphine is a medication used to treat opioid use disorder. It helps reduce cravings and withdrawal symptoms, making recovery easier and safer for patients.
I heard that if you give someone with opioid use disorder Suboxone, that you could reduce their chance of death by 50%. Is that true?
Yes, that's correct. Suboxone can significantly reduce the risk of overdose and death by stabilizing patients and decreasing cravings and withdrawal symptoms.
And a couple years ago, you had to have a special license. Do you need that license anymore?
No. As of June 2023, the requirement for a special license, known as the X waiver, has been eliminated. Now, any healthcare provider with a standard DEA registration can prescribe buprenorphine for opioid use disorder.
And tell me again what a microinduction is. What would I do if I had a patient in front of me who just told me that they were addicted to pills and they wanted help? How would you do a microinduction?
A microinduction involves starting with very small doses of Suboxone while the patient is still using opioids. You give a tiny dose, like 0.5 milligrams, and gradually increase it over a few days. This minimizes withdrawal symptoms and makes the transition smoother.
Do you remember what I call that?
Yes, you call it treat them when you meet them.
So you're saying, instead of saying we don't do that here, you have to wait 90 days to be seen in a special clinic, and you have to see an addiction psychiatrist with a special license. You're saying the very day I meet them, I can give them a very tiny dose, and they can keep even abusing drugs if they wanted, but you give them a small dose the very first day. You're saying that would work?
Exactly. By giving them a small dose right away, you can start stabilizing them immediately, even if they're still using other opioids. It helps them get started on the path to recovery right away.
What would the reduction in mortality be again?
It can reduce their mortality by up to 50%.
That's crazy. And this really works.
Yes, it does. It's been proven effective in numerous studies and can be life-saving for many patients.
Should I combine it with anything else?
Yes, it's often combined with counseling and behavioral therapies for a comprehensive approach to treatment.
Okay. And will you tell them what your nickname is, what I call you?
Sure, you call me Suzie.